guys, this is Alicia with Good Morning Sunshine. So today we had 4 lectures. I'm going to go over again 3 of them with you because bacteriology, I always have to wait for that PowerPoint, so I never get a chance to go over those. But we have parasitology today. I think we had clin path, and then we also had pharmacology today, as well as a fecal flotation lab, which I just got done with. So today at least we got out a couple hours early, but still a long day. 8 to 5s are killing me. But we have a lot of stuff to know this time. It's so much stuff and so much specific names. Sorry, I'm really bad with S's, if you hadn't noticed. So I'm going to start with parasitology. We're on platyhelminths. So those are our tapeworms and flukes. And there's 2 classes that we have: the cystota, which are the tapeworms, and then the trematota, which are our flukes. So we also have, from the class Cystota, we have families. We went over TNA yesterday, and now I'm going to go over Dipylidae. I'm not even going to try to say it. I'm going to show it to you. So we have this one here. So the Dippy one, and then we have the Anoplocephalidae one. I think he said we didn't need to know those names, just that we need to know there's Tianidae and then non-Tianidae, which are those. These are our common tapeworms. So these tapeworms have a metacestode stage called the cystic ceroid, which means small cyst with invaginated single scolex, member scolex being the head. But with these, there's no fluid filled bladder. They're also not very pathogenic. We're going to start with Dipylidium caninum, which is a parasite of dogs and cats worldwide. These can be 15 to 70 centimeters. It's the most common tapewort of dogs and cats in the United States. Here's kind of what they look like. It's kind of a small picture, but there we are. Their life cycle is again in the small intestine. They have gravid segments that are released containing egg packets. They have an indirect lifestyle here. Their intermediate host being fleas. Lice is an uncommon intermediate host of these. So flea larvae ingest egg packets. The sister cercoid develop before flea becomes adult. The infection of the direct host follows ingestion of the flea. The prepatent period is 2 to 3 weeks. So they release segments. The eggs are inside a package. The larvae of the flea like eggs and segments of the Dipylidium caninum. Then the flea becomes an adult, and then the dog eats the flea, and then the dog itself becomes infected that way. The diagnosis, it's very common, but the tapeworm segments in the perianal area or around the feces where animal sleeps. The egg packets are usually not seen in fecal exams unless the segment is broken up in a sample. That's the same as the TNA species. The egg packet is around 200 so it's bigger than hookworms, so do not confuse them with hookworm eggs, because hookworm eggs are only about 50 Its clinical importance: it's an infection generally subclinical. It's zoonotic, so young children are most likely to be infected, but very uncommon. The child has to accidentally ingest the flea. The flea control is critical to prevent infection or reinfection. The infectious states is the infected flea, of course. This is the cystocercoid with the sister cercoid inside. So just to go over their life cycle more in depth, I'm going to go through it with you. So we have the proglottids is in the feces. Each proglottid contains egg packets. These protoglottids disintegrate and release these egg packets. The egg packets contain the embryonated eggs. These are ingested by the larvae stage of the flea. And then the conospheres hatch from the eggs and penetrate the intestinal wall of the larvae. The development of the sister cercoid is infected. Then there's the development of the cystic ceracoid. And then the infected larval stage develop into adult fleas. The adult flea then harbors the infective cystic ceracoid. The host is infected by ingesting the fleas containing the cystic ceracoid, and then humans can get this parasitic disease by ingesting the infected flea, or animals can also transmit the infected flea to the humans or to us. The scolex, meaning the head, attaches to the small intestine in humans, and then the adult is now in the small intestine of us humans. So that's their life cycle. I can show it to you in this picture so you can see it also. So now we're going to get into common ruminant and equine tapeworms. Here we just have to know that cattle and sheep are the Monazea and horses are the Anoplocephala. So here's the actual names, so I don't want to butcher them for you. So we have cattle here, we have sheep, and then the horses tapeworms. So again, ruminant and equine tapeworms, their life cycle, they have gravid segments that are released containing the eggs. The eggs are ingested by the intermediate host, so the orobatid mites in the pasture, those are also known as coprophages. The cystic ceracoid is in mites. The definitive host is infected when ingest the infected mice while grazing. And then the equine tapeworm is important. It's very common. It has very common infection. It is a short tapeworm clustered at the ileocecal junction. It's usually asymptomatic and it occasionally causes inflammation and ulceration. In most severe cases, it is associated with perforation and utotussusception. And that's what these look like here. And then clinical importance, it's difficult to diagnose. So they release egg inside the protoglottids. So that's what makes it difficult to see the egg packets, like I said before. Surprisingly, the segments are not seen in the manure. The eggs usually are not present on a fecal exam either. Because diagnosis is so difficult, horses are routinely treated once per year. Infection can't practically be prevented. And then ruminant tapeworms, there's two species. Again, it's the Monazea penideni and the Monazea expansia. The first one being in cows, the second one being in small ruminants. Is a very common infection. The diagnosis frequently sees segments in the manure, especially in young animals. Eggs are in fecal exams. Their shape is square-like. The penideni are square, whereas the expansia are triangular. So I can show you those here. As you can see, they're square on this side, and then we have triangles too. And then the clinical importance is dramatic, but most studies show no significant effect on production. Other tapeworms are not common. You can find tapeworms in just about every vertebrate. Some avian tapeworms can be pathogenic in large numbers. And then we're going to get into now Trematode flukes. So again, they're of the phylum Platyhelminths. We just went over Cystota, those are our tapeworms, and now we're going into Trematode, which are our flukes. So flukes are flatworms. Important flukes of domestic animals and humans belong to order Degenia. So they go through, that means sexual reproduction as well as asexual reproduction. So sexual reproduction happens in the definitive host, whereas asexual reproduction usually happens in the intermediate host. So they are usually leaf-shaped, they're unsegmented, so that's different from our tapeworms. They have 1 to 2 suckers. Operculated eggs are passed in the feces, usually diagnosed with a fecal exam. They usually have 2 intermediate hosts, and the first is usually always a snail. Trematode life cycle, most fluke eggs must hatch in water. So the larvae, also known as the Miracidium, this is the first larval stage. They have to swim to a specific snail host. They have to do this fast because if they don't find a snail in about 4 to 5 hours, they will die. Some flukes also use land snails. The egg is ingested by the snail. Asexual development in the snail, so sporocyst and radius. Each redia produce a cercaria. A sporocyst has many redia. So still with the life cycle, the nest larval stage is produced by the snail, the cercaria. They usually swim to the pasture. This becomes the infective stage, the metacercaria, and the metacercaria can be ingested by a second intermediate host. The definitive host is infected when it ingests the metacercaria. It can be from the intermediate host or from a paratenic host. So flukes in the U.S. for ruminants, we have liver flukes, also known as Fasciola hepatica, which those are in the Gulf Coast, the Midwest, and the West. And then we have Fascioloides magna, which is found in the North and Midwest and Northeast. For small animals, we have Nanophyetus salminicola. This is found in the Pacific Northwest. So Fasciola hepatica is in the liver or the bile ducts. It's about 3 centimeters. And then we have Fasciolus magnus, which is about 5 centimeters. So again, the dots are in the liver and bile ducts of the host. Fasciola hepatica is in ruminants, rabbits, humans, dogs, and others. Fascioloida magnus is in white-tailed deer. And this is what they look like here. And then we have their life cycle for Fasciola hepatica. The adults release eggs in the feces that hatch in water. The mares carcadium have to find a snail. The first intermediate host is usually a snail, and that's where asexual reproduction occurs. The cercaria insist on vegetation. They also get stuck there and become metacercaria, being the infectious stage. So then this is ingested by the definitive host in the pasture. The humans can get infected if they accidentally eat the metacercaria, so the infected crops and their vegetables, when they're not cleaned thoroughly, they end up eating them. He said it was a problem in Venezuela, I think. There might have been another place as well. Fasciola hepatica's life cycle, again, after ingested by the definitive host, the larvae fluke migrate to the liver, and after several weeks enter the bile duct and mature there. The prepatent period is about 3 to 4 months. Its clinical importance in ruminants cattle can cause chronic pordoing, may have acute disease associated with liver migration, that's in usually our small ruminants, and diagnosis is by egg detection. Control is difficult because it's hard to eradicate snails. Again, more clinical importance, it's in the Gulf Coast states, like I said, the Pacific Northwest, and in Hawaii. So getting into Fascioloides magna, it's important in the Midwest and Northeast. The larvae cause serious disease in sheep and goats because keep migrating around the liver until the animal dies. Sheep and goats are abnormal hosts, so they don't complete their life cycle. That's why they get stuck there, and that's why sheep and goats die from this. It's hard to control, the same cycle, but different snail. Flukes in small animals, none of national importance. We have a liver fluke in cats, known as Platynosomum fastosum. So this is from ingesting lizards in the southeast and Hawaii. And then we have flukes as vectors of the Rickettsia disease. These are Nanophyetus salminicola. Then it's an intestinal fluke. It's actually a vector of carnivores in the Northwest. The first intermediate host is the snail. The second intermediate host is fish, so dog gets infected by eating metacercaria in the fish. Bacteria is the problem, not the fluke itself. The fluke is what carries the bacterial organism, so the Rickettsia that causes the salmon poisoning in dogs. And then another fluke transmitted disease is fluke of bats. I'm not going to say this name, but it's an insectivorous birds serve as a vector of potomatic horse fever. Horses just are incident bystanders in this cycle. So the horse eats a fly that is infected with this bacteria, and this is how they get accidentally infected. So that was parasitology. Let's see. Okay. I'm pretty sure that was the one we did today. Anyways, let me see what we have next here. So then we had clinical pathology 6. So we went over erythrocytosis and fibrinogen. So erythrocytosis, it can be relative or absolute. So let's go over relative first, because I think that's what I have notes on first. Okay, so relative, that means hemo concentration, so elevated PCV, packed cell volumes, and HCT, hematocrit values. Laboratory support is again increased total protein, so hyperalbuminemia, so increased albumin, plus or minus hyperglobulinemia, which is hemoglobin, it's increased as well. Then we have hypernatremia and hyperchloremia, so increased UCG, urine specific gravity, and then the causes are usually dehydration and fluid shifts. Also relative, we have the excitement stage, so horses and cat, the increased number of red blood cells. Epinephrine, this is our epinephrine flight or fight response. We have an increased packed cell volume. Red cell number also goes up. Neutrophils go up mildly. Lymphocytes are increased mildly. And we have hyperglycemia, so glycogen lysis in the liver due to epinephrine. So mild increase in glucose as well, and as well as an increase in platelets. This is mild thrombocytis. And then let's see. And then we also have absolute. So absolute being the number of red blood cells higher than relative change. And here we have primary and secondary. And then we go to appropriate and inappropriate for absolute. So primary is the neoplastic process. So this has to do with hyperplasia and unregulated cell growth, so that's neoplasia of red blood cells. It is a type of leukemia and it's very rare. However, secondary, we have increased EPO, so that's the erythropoietin, so increased erythrocytosis. And then from there, we have appropriate, which means increased levels of erythropoietin and decreased oxygen levels. So oxygen levels are reduced due to altitude, more red blood cells are produced, and the environmental has low oxygen. And inappropriate is increased erythropoietin, which secretes tumors. So fibrinogen, fibrin is the end product of homeostasis. It comes from the liver. It's part of total protein value. So if we let the blood sample clot, like serum, we lose fibrinogen because it was formed in the red top tube. Fibrinogen yields fibrin, which is insoluble, and this helps form initially the primary blood clot to stop bleeding. So normal homeostasis, we have normal stoppage of bleeding. So we have the vasoconstriction phase, then we have the primary homeostasis, and then we have the formation of the fibrin plug, and then lastly we have the counter mechanism. So it has the vasoconstriction phase, which we have right here. And then we have the primary hemostasis. So P is for platelets. This is how we remember it. So platelets form the primary plug to facilitate later steps in the process. So they blow up the platelets. The von Willebrand factor is exposed. The platelets grab a hold of it, and then the fibrinogen does cross bridges. The second, fibrinogen needs to be converted into fibrin. So this is secondary homeostasis. It occurs at the end, which occurs with the action of thrombin. So the clot gets really strong after this. It's cross-linked with fibrin. So cell-positive feedback loop, it needs to be in check. So this was the formation of the fibrin plug. This was secondary homeostasis. And then we have a counter mechanism. So it tries to break down secondary clot, to digest fibrin, so making clot and breaking down clot at the same time. But this has to be kept in check because we don't want it to make excessive clots, because it won't stop unless it has a mechanism telling it or breaking down the fibrinogen as it's making the clot as well. So I'm going to go over this whole thing with you actually right now, of what I was just talking about. So the von Willebrand factor, platelets go to this factor, they become activated, it recruits fibrinogen to start forming the primary platelet plug. So fibrinogen does cross-links with the platelets. The tissue factor, also known as TF, is an important molecule in the secondary homeostasis. It initiates coagulation and it is a component of the extrinsic arm. It activates 7, and then 7 activates 10, which activates 5, which then activates 2, which then activates 1. And then once it gets to 1, that's our fibrinogen. So it converts fibrinogen to fibrin. Now it is a lot stronger. So they slow down the hemorrhage process, and then secondary fibrin plug is there. And then for controlling this, the regulate process. So we shut off so we don't turn into just a giant clot. This is the fibrinolysis pathway. Plasminogen activator activates plasminogen. It converts plasminogen to plasma. So plasma likes to chop up the fibrin, and this is how this works. So this is just how to stop the bleeding. We have inflammation as well, so the inflammatory cytokines induce this. Fibrinogen is the positive acute phase protein, so liver produces all different types of proteins. They produce increased amounts. So we look at the acute phase proteins, the fibrinogen. Large animals have a lot of this normally. However, dogs and cats use something else. They don't have much fibrinogen. So this is small intestine glued together due to inflammation right here. And then we have hyperfibrinemia, which means dehydrated loss of free water. Fibrinogen increases during dehydration or the acute phase response because of inflammation. Regular proteins are the same, whereas fibrinogen is increased. So only excess ratio with elevated fibrinogen. So D equals dehydration here and I equals inflammation. So lower values equal inflammation usually. So here we have the fibrinogen for ruminant, it is less than 15, and then we have of a horse less than 20, so this would be dehydration in this case. Here we have ruminant between 10 and 15, and then a horse of fibrinogen is 15 to 20. This would be due to inflammation. And then we have greater than 10 and greater than 15. This would also be due to inflammation. So hyperfibrinogenemia come from the liver, so decreased production would lead to liver failure because they can't do secondary homeostasis, which is life-threatening here. Increased consumption is life-threatening condition as well, so the intravascular coagulation is life-threatening, so the coagulation cascade. Inflammation is a prothrombic, so that means the foot on the gas that drives the cascade that I was talking about, and this leads to spontaneous bleeding. We have declined platelets, so see red cell fragments in the blood, such as the cystocytes, the acanthocytes, and the keratocytes. And then he went over examples, but I'm not going to go over those with you. So that was the end of ClinPath. And then I'm going to talk to you about Pharmacology 5, which we were talking about antihelmintics. So we went over a few definitions. We have parasitology, that's a drug that kills parasites. Then we have the antihelmintic, which is the drug that kills worms, so our helminths. And then we have pesticide, which is a drug usually used for external parasites, such as arthropods. And then we have insecticides, which kill insects. And then we have archaicide, which kills ticks and mice. Mode of action means how a drug actually works. We have spectrum of action, which is the organisms affected, so a broad spectrum versus a narrow spectrum, so relative term. We have efficacy, which is how effective the drug is against an organism. And then we have persistent activity, which is the length of time the drug maintains efficacy after administration. And then we have extra label use, which is the use of an approved animal drug in a matter that is not in accordance with the approved label directions. So an overview of the antihelmintic discovery and development process. It's very long. It's hard to get things approved also. And then we have anti-parasitic drug regulation, which is by the Food and Drug Administration, so the FDA through the Center for Veterinary Medicine. The CVM is the legal authority to approve and regulate drugs for animals. So drug has to have a 90% efficacy for these anti-helminths drugs. However, if we're going through the WAAVP, they give guidelines. It's not a must, but it can be followed, but they can also be changed. However, they want a 95 to 98% efficacy. The anthelminths, what you know about them, we have major groups and their members, the mode of action, their general spectrum of activity, the routes of administration, and safety, only in general terms though. So again, groups, we have the big three. We have benzimidazoles and probenzimidazoles, and then we have nicotinic agents, and then we have the macrocyclic lactones, also known as ML. So we're going to start by the benzimidazoles and the probenzimidazoles. So generic names in this group usually ends in azole. It's released for commercial use in the 1960s. It's widely used in veterinary medicine. So members in the U.S. used fenbendazole, albendazole, fibrinogen, and others are oxybendazole and oxbendazole. Their mode of action, they bind to parasite beta tubulin, so albendazole blocks this assembly, and it prevents microtubule assembly, so it interferes with the cell internal structures and metabolism, and it causes slow parasitic death. We need to stay away a while to work. So the ruminants can act as a reservoir for absorption in ruminants and horses respectively. Small animals usually need several doses of this. So their spectrum of action, nematodes primarily for small animals. They're adulticidal, larvicidal, and ovicidal activity. For trematodes and cestodes, it's adulticidal, essentially in ruminant flukes and tapeworms. Their administration is by orally only because they're not very soluble in all animals. Safety, generally very safe. The exception is the on-label follow directions. So the albendazole ruminants during early pregnancy don't give, and fibrinogen don't give dogs during pregnancy. Occasionally toxicity with extra label use in exotic species, but check before you use it. At least one approved BZD, so that's what we were just talking about. For common domestic species, dogs are widely used, so the fibrinogen and fenbendazole and the albendazole is not approved, but we can use in an extra label way. For horses, it's widely used. Fenbendazole is the most used right now, but you can also use oxybendazole. For ruminants, it's widely used albendazole and fenbendazole, and pigs and poultry, it's also widely used the fenbendazole. Now we're going to get into nicotinic agents. They're going to bind to the nicotinic receptors. They have two families. They have the imidazothiazoles and the tetrahydropyrimidines. They were introduced in the 1960s. Both share a common mode of action. They act selectively as agonists at nicotinic receptors on the nematode muscle cells, depolarizing neuromuscular blocking drugs, contraction, and rapid spastic paralysis of worms. Their administration is primary oral. Their spectrum of action is a gastrointestinal nematode, so adults. Lungworms are adults in larval stages, and periental and morental are not observed from the gut. Safety here, safety margin of lefamazole. I told you he doesn't like this, the professor doesn't like this drug at all. It's usually not used at all ever anymore because it's not safe. Signs of toxicity is related to the mode of action. It works in the host as well. Salivation, tremors, ataxia, urination, and defecation. Where are they used? They're used in horses, ruminants, mostly small ruminants, and dogs and cats. And then we are going to get into macrocyclic lactones. It's derived from products made in soil fungus. They're also called endectocides, so against internal and external parasites. So two families, we have the milldamycins and the ivermectins. They overlap chemically, so they share the same motor function. So as you can see, this would go into this. This is this part of the ivermectins here. It's the first compound isolated was abomectin. This has created the ivermectin and epinomectin. Mutation in the lab also created doramectin, and selamectin was created. And then the macrocyclic lactones, ivermectin binds to the chloride channel. The channel will then open, allowing the entrance of chloride. This causes muscle paralysis with effects, which affects parasite reproduction. Its mode of action is to bind to glutamate-gated chloride channels, leading to the hyperpolarization of nerves and muscles. Multiple effects in muscles, so paralysis of muscles affects parasite reproduction, just like I said. Some products have persistent activity affected by formulation and administration route. Spectrum of actions for nematodes, so adults, the mucosal larva, the hypobiotic larva, and then for arthropods, blood-sucking and tissue-dwelling, varies, depends on product and species. And the routes of administration for these is oral injection, topical absorbed through skin, and then safety, it's very safe, a general wide safety margin, so mammalian toxicity probably related to GABA synapses. Neurotransmitter in the CNS of vertebrates. This is a genetic problem in some breeds of dogs. Microlides generally don't reach susceptible targets in the vertebrate CNS because of the blood-brain barrier. Toxicity is related to CNS depression. So ivermectin in dogs is approved dose, okay, for all dogs. Higher doses may cause problems in dogs, especially the collies. Do not use at high doses in collies. Sensitivity due to mutation affecting the P-glycoprotein, so part of the blood-brain barrier. Other breeds have mutation, but at a low frequency, so 70% in collies, 5% in mixed breed dogs. Other have higher safety margin in susceptible dogs. Where are they used? Everywhere. So horses, cattle, small ruminants, dogs and cats, many exotic animals, humans, and fish. Other groups, we have our isoquinolines, that's our praziquantel and epsiparental, exception for the 40-year-old story. So he told us that a drug hasn't been approved in 40 years, but these are our newer drugs. They're used for tapeworms and some flukes in small animals and horses. There's no effect on nematodes. They're the only drugs approved for tapeworms in small animals. Their mode of action is unknown, but it seems to affect permeability of calcium ions in the muscular membrane, so tectonic contraction of muscles. It is safe and effective. And then we have our arsenicals, which are toxic for dogs. We have the marasomine. It's used for heartworm treatment because nothing else works. It's most effective against adults. It's not effective against microfilariae or L3, early L4 stages. It's not for dogs in poor health, so many adverse reactions and side effects. The mode of action is unknown. Also, other groups, minor players, we have the cyclic octodepsin peptides. They currently marketed for cats in the U.S. It stimulates specific neuromuscular receptors. The spectrum is only nematodes. Then we have our benzosulfamides for bovine liver flukes as our fasciola species. It's sold in combination with ivermectin, and it inhibits fluke glycolytic enzymes. And then we have our piperazine, which is very old. It's used mostly for aspirin nematodes, or roundworms. It paralyzes the worm. It's anticholinergic. It's available in a wide variety of over-the-counter products. Other drugs or other drug groups marketed in other parts of the world. Market determines where they would be introduced in the U.S. So we actually made up some charts here that I'm going to show you. So our benzimidazoles are for nematodes, trematodes, cestodes. We have nicotinic agonists, which are used for our nematodes. We have macrocyclic lactones, which are also used for our nematodes and our ectoparasites. And then we have our isoquinolines, which are used for trematodes and cestodes. Our arsenicals are heartworm only. Our cyclic octodepsin peptides are cats only in the U.S., used for nematodes. Our benzen sulfite amides are used for trematodes. And then he went over our primary mode of action for all of these as well. And then he didn't get this far, I don't think. And then he'll go over that in more detail there. And then that was it, guys. I thank you for hanging in there with me. We have a lot of information. All these weird big words that I cannot say on the videos I'm gonna have to learn them. Not have to say them, so that's good. I just have to know what they are. But yeah, still lots of information. We have lectures all week. Also labs all week, so that's been a killer too. But learned how to do fecal flotation. Yeah, so that was fun. Also direct smears we did today too for fecals. But now I know how to do them. So that was exciting. I hope you guys had a good, I don't even know what day it is, Wednesday. And I love you guys so much, and I will, I also wanted to mention at the very end of this, I wasn't gonna mention actually at the very beginning. So I got this really nice video from my girlfriend's aunt and our little small children. Well, they're not her children, of course, but anyway, they said hi to me in a little cute video. It made me cry, actually. Happy tears. It was the cutest thing ever. That someone their time out of their day just to make my day just a little bit better, to tell me they're thinking about me and they hope I'm doing well, and just tell me hi, to break up my day a little bit. So it was really nice. I love her family. I love my family too. But it was great. It was like one of the best videos I received, because people don't send me videos, so it was really nice. But yeah, I love you guys, so that was a shout out to you guys. But yeah, I also love you, Athena, but you should know that too. But yeah, I think that's it for today, and I will talk to you guys more about more lecture stuff tomorrow.